March is Women's History Month, and today we're taking a bit of time to acknowledge women making strides in their career. In particular, one doctor dedicated to healing others. Dr. Rachel Rohde is with us now, a doctor of orthopedics at Michigan Orthopaedic Surgeons. Good morning, Rachel.
Good morning.
So how did you get into orthopedics?
So orthopedics found me, or I found it pretty much by accident. I really loved surgery when I did rotations in medical school, and then I liked radiology. And so I sort of stumbled upon it by accident and loved it. It was quite fun and interesting.
So what's your favorite part?
You know, I love having the ability to make people better. You know, we have immediate impact on patients' lives. And so we don't generally save lives, but we do save lifestyles. And just knowing that I did that at the end of the day is terrific.
And that's huge, right? Saving someone's, if someone's in pain or what have you, that's great. Why do you think there's a lack of women in your field?
Well, traditionally, there have only been about 4% women in orthopedics. So it's up to about 6.5% now, which is really a shame because we have over 50% of medical students who are women. And I think it's really a matter of people not having role models, not being introduced to it early enough to know that it's an option for them. Like I said, I found it by mistake, and I was almost all the way through medical school when I found it. So.
And do you see this lack of women as a serious problem in this career field?
Well, I think like in any field, I think diversity brings a lot of advancements, in terms of patient care, in terms of technological advancements in the field. So, yeah, I think that having a lack of diversity in orthopedics or any field is problematic.
And what can be done to encourage women to get into this career field?
So there are a lot of things that are done on a national level. There is a program called the Perry Initiative, and we've been hosting programs with the Perry Initiative, hands-on programs for young women to be introduced to engineering and orthopedics as opportunities. But just on like a smaller individual level, I have women shadow me all the time, young women, high school, college, medical students who shadow us in the operating room or shadow us in the office, see what we do. And I think that helps a lot, kind of seeing what could be in their future.
And learning from a peer.
Absolutely.
Is there anything in particular that Michigan Orthopaedic Surgeons is doing? I know you said that, those young women shadowing you is a huge step, but anything in particular with Michigan Orthopaedic Surgeons?
Well, the shadowing definitely is big because we have over 40 orthopedic surgeons. Dr. Endress, who is another one of my colleagues, she and I have been participating in the Perry program for many years now, and we have guided over 500 women through this exposure program where they're introduced to orthopedics as early as age 15, 14. So.
Dr. Rachel Rohde, thanks for being here with us this morning and really shedding some light on this topic. Very interesting.
Thank you. Thanks for having me.
Of
Appreciate
course.
it.